I recently reminded the First Minister of the ongoing terrible and disabling experiences of Welsh women fitted with vaginal mesh and noted that the initial discovery report didn't mention them at all. So I asked her about how the treatment of mesh patients would be included in the plan, what funding would be allocated to them, what conversations have happened with the new Westminster Government around the UK-wide response to the Hughes report, because we've had no statement from the Welsh Government, although that report was published last February. In reply, she told me we'd have to wait for the publication of the plan, and she's written to me today confirming there's no mention of these issues in the plan, although promises were made to the task and finish group set up by Vaughan Gething around specialist services. So when can we expect a response on the Hughes report? Dr Hughes said that this is a health scandal and injustice as big as thalidomide, and it specifically affects women, thousands of women in Wales. So for the First Minister to say in her letter to me the plan can't mention every area of women's health, and as an example for not addressing this issue isn't good enough. So what action will you take, Minister?
Although the plan doesn't specifically talk about mesh, the plan contains 8 priority areas identified by women in the discovery phase, and the determinants that led to the adverse experiences of women having mesh complications are being addressed by the plan. The Welsh Government is considering the recommendations from the Dr Hughes report. We are working closely with colleagues in the UK Government and other devolved administrations in ensuring that the response by the UK Government takes account of the impact on patients harmed in devolved nations.